It's one thing for the province to say they have a timeline, and much beyond that, it's another thing altogether to make sure that people are actually vaccinated. And that falls to the cities and the regions and the local public health units. So will all that confusion you were just talking about actually exist on a local level as well? We went for a behind-the-scenes look. Inside Malvern Community Recreation Centre, there are signs of what's to come. But the COVID vaccinations that will eventually take place here aren't happening yet. That's up to Toronto Public Health to get shots into the arms of people once the vaccines become available. Each of the province's 34 local public health units, in fact, are responsible for actually getting the job done based on the province's parameters. How will you coordinate the on-the-ground logistics for what seems to be a very complex provincial framework for that rollout?
They are in control of the booking and registration system. They're in control of the distribution of vaccines, and they're in control of the priority setting for who gets vaccinated when. So I would say that makes them, in effect, the managing partners.
We do have a great deal of expertise in this arena. Every single year, we run school-based immunization clinics, and they can be quite sizable. We also run flu immunization clinics and have had a long history of doing that.
Toronto officials claim 9 immunization clinics are set to open in Toronto before April 1st, with promises of more than 120,000 doses to be administered each week. Brampton Mayor Patrick Brown announcing another 2 locations for vaccination clinics in Peel Region as well, in addition to 5 that had already been identified.
This is really going to give us the capacity, once vaccines arrive, that we can vaccinate the public in large numbers.
Aside from the groups already identified by the province for early rollout, prioritizing communities and groups who have been at a greater risk for catching COVID-19 will need to be a focus.
The challenges are really quite real, and part of this is about being able to communicate and meet people where they are. And we have a fractured system, and COVID has certainly taught us that we do have a fractured system. So part of this is about building and flying the plane at the same time, I'm afraid.
Aside from mass vaccination clinics, primary care physicians, hospitals, and pharmacies, at this point, Toronto is planning to include mobile sites to reach those in need.
Envisioned as part of that plan as well are mobile immunization clinic opportunities, and as well some focused response efforts, meaning pop-ups, clinics that get set up on a more temporary basis in areas where those are needed.
Some of that targeted community response is set to include a widespread multilingual campaign as well. Also, in response to my questions today, Fire Chief Matthew Pegg said that Toronto's teams that are putting together their immunization plan have recently expanded. He called them robust, and that they are in touch with the province's immunization task force on a daily basis.